In our previous post, we looked at iron and iron deficiency. This is a common affliction that can present with non-specific symptoms like tiredness, fatigue, shortness of breath, pale skin, and hair loss. There are different treatment modalities available to treat this condition. We start with oral supplementation. Unfortunately, this often goes hand in hand with symptoms of constipation and other gastrointestinal disturbances. Another drawback of oral supplementation is that it usually takes a long time for it to become effective, as iron needs to be absorbed through the gut, which is often compromised in patients. Another treatment option is intravenous supplementation of iron through IV drips. This works effectively and far quicker, although this can have serious consequences like allergic and even anaphylactic reactions if not done properly by a trained medical practitioner. Iron needs vitamin C to be absorbed effectively. So optimal supplementation of vitamin C and even other cofactors like magnesium, copper, zinc, and selenium play a role in effective treatment of this condition. If you want to know more, or if you think that you battle with iron deficiency, contact us at the T Clinic on 010-824-1393.